Is that correct?
That's correct. I think you have 4 people and you need 5 to have a quorum.
All right, well, we can have a meeting anyway. So I'll call to order. We'll dispense with the approval of the minutes. Pam, were you able to come up with this information that we had requested?
On the okay, so the data,
The data?
I have. It is in progress, and I will tell you honestly, it is a huge manual effort.
Okay.
And the person that I had working on it has been out unexpectedly, so I've been was trying to work on it this weekend, but want to, if you will, give me to the end of this week, and we will post it, and I'll send it to you so that you can send it out. I just want to make sure that all of it is accurate, and that I feel comfortable with it before I send it. But I do have, so I've got the 30-day, the number of people of 30-day discontinue notices, and I have residential and non-residential. However, we didn't track on the non-residential if they went to a different provider for that same service, or if they just change services altogether. So that I would have to have somebody manually look up, but we can, there's not so many that's an unsurmountable task.
Right.
So I can give you kind of a preview, and I know we weren't looking at 2021, but I also had 2021 data, and I have it in front of me, so I can give you kind of just a preview of it.
Oh,
we
please.
had so far in 2021 we had 18 involuntary program closures. I'm sorry, there were 18 that were because of agency closure. There were 30 total, so 18 because of program closure. 12 were issued to the individual not related to agency closure. Now, of those 12, we have 5 that are either in the community now. They chose to exit residential services, and they're either living with family or living with someone else, or they're with a new provider. 7 that are still with their current provider, and then I'm looking at the time frame that's been going on. But so that's the kind of information I'm going to be able to provide. So is that
right?
Okay.
Right. And did you say that some are discontinued because the organization, the agency, went out of business?
Well, or they had, so it was an agency closure. So either a lot of those are these. I think that the 18 of those was it was one provider that was, I believe, a change of ownership. So they were bought. So they because the member gets no say in that, they get looked at as an involuntary program closure. However, those are handled differently because of how we help in finding them a new provider, and they are required to continue serving them, but that's part of the provider participation agreement, that if they choose to change ownership, then they have to continue serving the individual if the individual chooses to leave them. Some of them went to the new, in those change of ownership, some of them decide to stay with that provider. But it's all, again, they're given a choice as to whether or not they want to do that. And those things are honestly in motion almost all of the time.
Right. Let's go back to the number of people you say were discontinued, but they're continuing to receive services by the same provider.
Yeah, there are 7 that are still continuing to receive from the same provider.
Okay, and this is just for 2021.
This is 2021. An interesting thing, because we also looked at, were the individuals receiving exceptional supports at the time of the involuntary termination, and none of them for 2021 were receiving exceptional supports or had a request in for exceptional supports at the time of the involuntary termination.
Well, that's
so
interesting.
all of that'll be in
all of that'll be
in the report.
Well, I think we'll all like to see that, won't we? It'll
It's
be,
pretty, it's very interesting, honestly. I was surprised about the exceptional supports piece.
Right.
That none of them were receiving it. I thought that was interesting. So,
yeah, and whether or not they just weren't aware of exceptional supports or they found the process too difficult.
well, and
No.
we are looking through, so some of them we started previewing, looking at the case management notes, and weren't getting a lot of information there either, saying, where the case manager mentioned anything about in the team meetings, exceptional supports being discussed. So
Mhm. Well, this is something to really drill down on, I think. That will be interesting.
yeah, it looks there's some interesting information. I'm anxious to be able to get it out
Yeah,
there for you all to see it. So we will. So by Friday, I will get that to you, Rick, as well as we'll get it posted on the tax website.
right. I wanted to also do kind of the waiver task force met on the 18th, or excuse me, the 23rd of August, and I thought that was a very good meeting. I thought Pam, you in particular, made a good case for the need for additional resources for waiver programs. A couple of things were discussed that I thought were interesting. One is that in terms of similar services between Michelle P. and SEL, you were going to bring the rates up to the highest of the two. Is that correct?
That's across the board. So for all waivers, we are looking at that. That is something that we've met with the secretary, and that we are looking at across all waivers, similar services, bringing them up to the same rate. So that is something we currently are evaluating. Also, I just posted in the chat the links. So for anybody that hadn't been able to watch those task force, I posted the link to the YouTube channel LRC, where you can find the recordings, as well as to the waiver redesign task force website. So
Good. And another thing that I recall being discussed was another rate study.
that is part of, we do have to complete a rate study in order to be able to do anything with services or anything with the rates. So that is something that we will be doing. We don't have a target date. The money for that we have, that was part of what, if you all remember when I talked about what was in our spending plan, or if you've had the opportunity to look at what was in our spending plan for the ARPA, the enhanced FMAP funds. We set aside some dollars for to have a group come in to do that. But we're still waiting on a response from CMS on that. So
What response? What have you asked CMS if they would approve your
we submitted we had to submit the initial spending plan and narrative for what we would do with those funds. And so the last that I had heard, there were, I believe, 11 or 12 states that had received feedback. So we still are waiting on feedback from CMS before we can move forward with any of the activities that were outlined in that.
Are we the 12th state?
I wish I knew where we were, and we're anxiously awaiting that. We've got a lot of work to do once we get once we receive feedback on that. So as soon as we receive feedback, we will begin stakeholder engagement sessions, and we'll we'll share more information. So more to come as soon as we hear something. There'll be more information shared.
And I imagine that study will have to go out for competitive bid, I suppose, if you use a third party.
We have to go through, we have to follow our procurement processes. Right. So.
Well, go ahead. I'm sorry. Anybody can ask a question on this call, by the way. So Don't.
This is
Oh, I see
Charlotte.
there's a couple of chat people here. Okay.
It's Charlotte. I just wanted to let you know you do have a quorum. Patty Dempsey has joined.
Okay,
You have a quorum, so you can go back and do the minutes when you get a chance.
sure, let's do that right now. Do I hear a motion to approve the minutes as distributed from someone?
I make a motion.
Okay, is there a second?
I'll second.
Any further discussion? All in favor say aye.
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 All opposed say no. Okay, that motion carries. Well, while we're on the FMAP discussion, what's the rest of the budget contain? And what's the latest?
So for that whole plan,
Yeah.
I would, it's posted on the, on the website, so anybody can go out to DMS's website and actually review the entire plan. It is, there are things that addresses workforce. There's some feasibility studies, but I would encourage you, if you haven't looked at it, to go out on the website and you can look at the entire plan.
Well, since I think most people are most interested in the DSP workforce solutions, can you talk a little bit, Pam, about what your plan deals with regard to workforce solutions?
So training and education are kind of the same thing. So training is a big part of that. Looking at innovative ways to help with recruitment and onboarding. There were also some, trying to think, I don't have it up in front of me. There were some discussion about immediate, some immediate relief. So to go out to providers, but again, I mean, that really is, it still is all up to CMS. So I really don't want to, I mean, it's out there and anybody can review it. Those are the things we would, would really like to do. But as I understand it, no state has received a complete approval on their plan yet. Most states have received partial approvals, and then CMS has asked for additional information. So
how much, do you recall how much money you budgeted for work?
I don't remember.
Okay.
It's in that it was a percentage. It was a percentage. I'm thinking it was 20 or 25, but again, I don't have it up right here in front of me. But it's very detailed in that narrative and in that spending plan that's on the website.
Is that what you just posted here, Pam?
No, that's to the waiver
redesign.
That was I shared last time, and I believe we may even have either shared the link last time or
okay.
I may have even sent it out to some people as well. So no, it's been out there for quite some time. So
okay, thank you for that. One thing it's related to this, and it's come up recently with the president's executive order, particularly the one I'm thinking about is the one that the Medicaid workforce vaccination mandate, and based on, I guess, our prior experience, that the Department for Health Services puts waiver services in that category of community-based, like nursing homes and community programs. Do you know anything about that? Is that mandate?
We have not had any additional direction on that yet. So I really don't have, not able to comment just because I don't have, we haven't been given any additional guidance other than what everybody heard in the presidential address and
Right.
what's been public. We have not been given any additional directive or information.
Well, let me just put this out here just as a concern. Well, obviously, a lot of staff will be resistant, but my concern is whether or not this mandate would extend to independent contractors, like with the FHP model, because if it does, I'm sure you can appreciate that would really be difficult for providers. I know there are parts of the state, these FHP providers who've really been through quite a lot and they don't want to get vaccinated for whatever reason. It could be quite a problem if we lost FHPs. Just something for you to consider when, to the extent that they ask for your input on this.
Just say, yeah, I don't know how much, Rick, that I will have input. I will just say, what I would advise everybody, use your voice, speak up,
Yeah.
which I'm sure all of you all will. I know there's Steve, I saw your comment. I think it is a concern amongst all providers. I've heard it across all, provider types. So just, continue to watch. We'll share information as we are able, but I honestly do not have any additional information beyond what anybody else in the public has heard or seen. So we'll share as soon as we have anything that any other information, but right now we're all on the same page. Everybody knows
Yeah, yeah.
what we know. So
And anybody else can comment on this, but I think part of the problem, at least in my mind, is that we are included, waiver services are included or considered a healthcare service like a nursing home and those sorts of things. And that I think that's questionable. I think people have questioned whether we should be in that category or not. Does anybody else want to comment?
well, I can tell you, Rick, we have done kind of indirectly related to this. We are closing in on, I think Wednesday is the date the survey closed, but we've just sent out another survey collecting information about vaccinations. So we'll be sharing the results of that, as well as I am working with Commissioner Elridge with Dale, and I am working with we're working with public health. There is what we're seeing in some of the initial results of the survey is just some either reluctance or fear about the vaccine. And so we are working with public health. There is an initiative for vaccine confidence that will provide some technical assistance as far as allowing communication to those individuals to answer questions, that type of information. So as soon as that survey closes and we get some additional information, we will act on that, and I can share those results once we get them all and are able to put together the analysis of it. But we've had a fairly strong response from providers to that survey. I believe we were over 250 responses, and we've still got 3 full days left of the survey. So,
well, just my additional 2 cents worth on the being in this category of a healthcare service, that includes the mask mandate, which is a great idea. However, when you have everyone vaccinated, staff and participants, but you have some participants who really can't mask, that's a problem too. We have a lot of, in our case, we have about 30 people who can't come to day training because even though they're vaccinated and everyone else is vaccinated, but they can't attend because of the mask mandate. So I think to look at whether or not we should fall into that category is important. And if they would reconsider that, I think that would be helpful. Does anybody else want to comment here? I know there's some chat. The industry is experiencing all-time staff vacancies. This will compound the crisis. Keeping patients safe is a priority. Vaccinated, yeah. So I guess we're all over the board on this, aren't we? Anyway, if there's no further comment, let's talk about waiting lists.
Okay, so we, STL right now, we total of 2,949, 0 in the emergency category, 118 in the urgent, and 2,831 in future planning. For Michelle P, we're at 7,624 with 5,627 of those being under 21, which is about a 74% percentage that are under 21. And we are holding about that. It actually is up about 2%. We had been staying right about 72% for under 21. We are sending out on Wednesday 300 allocation letters for Michelle P. And I will, Rick, I'll get this out in the template and
That'd
get
be
this
great,
shared.
yeah.
I'll so that everybody doesn't have to write it down. I'll send it out.
Okay.
Or we can post it to the website too.
Yeah, thank you, Pam, and we look forward to getting that information. If there's nothing else, we can adjourn. Oh, should we make a motion? Would someone like to make a motion to adjourn?
I'll make the motion, Rick.
Okay, any second?
I'll second.
Second.
Thank you. All in favor, say aye.
Aye.
Opposed,
Aye.
nay. We are adjourned. Thanks, everyone.
All right. Thanks, everybody. Have a good week.
Mm-hmm.
Thank you.
Bye.